It is Tuesday night, and you know what that means. This is episode 2 of Dear Skinny Friends. I am so excited to be able to do this again this week. Before we get started, while we're waiting on everyone to pop in, I just want to tell you guys thank you so much for all of the support, everyone signing up to be a guest, to bring your knowledge and expertise. I am incredibly touched, and I am super excited about this entire project, and I'm happy to be able to open up the platform so that we can all have a voice, right? And share our experiences and really open up that dialogue so that we can bridge that gap. So, tonight on Dear Skinny Friend, I have a topic that is extremely close to me, that has impacted my life a lot, personally, with myself and with people that I'm very close to, and that is chronic pain. Chronic pain is often, for those of us that have dealt with it, is known as the invisible disease or the invisible illness, because you look to be fine on the outside, but inside you're dealing with all of this pain that you can't describe. And for years and years, it was stigmatized as being something that was more of a mental health issue that was in your head and not necessarily something that was actually happening and taking place. So I have the privilege of bringing on a longtime friend of mine, a new friend of mine, as well as an amazing pain specialist, tonight to talk about chronic pain, what that looks like, being in a larger body, how it impacts our lives, and all of the things. So without further ado, I am going to bring on my first guest, which is Miss Alicia. Give me just one moment. Okay. Technology doesn't want us to be great tonight, but I'm not going to let it stop us. So let's see if we can do this again. Hopefully you guys start coming on. Let's see if we can get everybody back. I am so sorry. I don't know what happened. Instagram just completely kicked me out with no warning. So hopefully this will work and we can get going. Again, if you're just now joining, this is our weekly Instagram live called Dear Skinny Friends, where we talk about all the things that make us fat friends and us skinny friends different but the same. We talk about all the things that impact us living in larger bodies that sometimes our friends and family that love us dearly don't think about, and we just get really real about it. So tonight we are talking about chronic pain or the invisible illness. So I have 3 special guests that are joining me tonight. A good friend of mine, Alicia, who has been following me, and I've been following her journey for a couple of years now. A new friend named Spring, and a wonderful, wonderful pain doctor named Melissa, who is the challenge doctor. I am going to bring on Alicia, see if it will allow us to add her tonight. It was given some issues a minute ago. It didn't want to behave. So let's see.
Yay!
Okay. Does it say connecting or?
Yeah. No, we're good. We're good. I see the comments.
Okay.
And yes.
Nice. So if somebody can drop a number 1, just type number 1 in the comment box and hit enter. Let me know if you can see and hear Alicia just fine before we get started so that we can get going. Oh, Gabby Rocks, I'm so happy. I am honored to be able to do this and to open up my platform. So hey, Lady Onyx, how are you? Yay! Okay.
Yeah. Good.
We can see you. We can hear you, and we are good to go. Thank you, Melissa. Thank you, Kamika. Thank you, everybody, for letting us know that we can hear. So I would like to allow you to introduce yourself and tell us just a little bit about you and about your journey and what your take on this chronic pain issue is.
Okay, so, well, my name's Alicia. otherwise known as Beautiful Alicia, which mostly everyone knows me as Beautiful Alicia, because that's just like, I don't know, I've taken that on, you know, that name, that persona on. But I have been through quite a bit. I think I started in about 2011. I started YouTube, you know, the whole social media kind of thing. And I think at my largest weight, I was hitting almost 600 pounds.
Mm-hmm.
And life then was very difficult. I was in a shell. I didn't want to have friends, didn't want to like talk to anyone. Basically laid in bed all day, every day.
Right.
Ate in bed, did everything in bed. So I started doing YouTube, and my very first video, I was like, what am I doing? I feel so stupid talking to myself, you know, and just felt like, what, like, nobody's gonna, it's okay because nobody's gonna see this. Well, that wasn't true, you know. I worked it really, I was very lost. I didn't know who I was, where I was, and I didn't even know if I was gonna live another day. And at that point in time, my depression, my anxiety was so bad, I actually used to pray that I wouldn't wake up the next day. The only thing that kept me going was my son. You know, I mean, I think that that's where a lot of our stories, like, are so alike. You know, so many people, it's like they're children, you know, you're children. You have to be here for your children. So I see people saying, I love you, Alicia. So, you know, I started telling my story. Like, I started being completely 100% authentic, real, and you know, it's a good and a bad thing, because it's a good thing because you reach so many people, you know. And my thing is, like, you know, like, well, okay, first of all, before we go any further, can I say congratulations to you for how many 100K? Like, come on.
Thank you.
I'm like, oh my gosh, my girl. So, you know, and I was like, I just want to reach one person. Like, if somebody else who feels like they can't do it, but I've reached more than one person, you know. But if I can make a difference in one person's life, it's just like, oh my gosh, that made a difference. Because I felt like there was nobody who, at the point, like, before, I'm like, what is this YouTube thing? I didn't know what it was. I, you know, did it. And I was like, oh my gosh, people were sending messages, people were like watching me, and I'm like, what is going on? And I was very, very, at the time, I was very vulnerable, and I, you know, I had lots of positivity, but I also had lots of negativity, because people like to tell you that you're, people like to tell you that you're fat.
People like to tell you that you're fat, which is something that, you know, we kind of already know. I mean, we live in this body, but something that I noticed with you and your journey and following you is that a lot of times you would be honest about the pain and the hurting, the fact that it just hurt to do anything, and you wanted to make these steps and grow, but you were having difficulty, and people kind of came down on you and were really, really critical of you and everything you had going.
People like to put me down, and even now people like to put me down because, one, I'm on this, you know, I've been on disability, and I still currently am on disability, and people feel like that I am, like, I'm not deserving of getting any kind of help, you know, like none at all. And I'm like, you know, I'm just like everyone else. Like, I deserve just as much. Just because I'm on disability, just because I'm on government assistance, does not mean that I don't deserve. Like, I deserve to live just like the next person, you know. So I fought really, really hard, and I fought through all this. I mean, I've had, you know, people tell me that I should kill myself. People tell me that, you know, just horrible, horrible things. I remember the very first time I got a comment like that, and I cried and cried and cried, and my boyfriend said, what's wrong with you? Why are you crying? And I'm like, because that hurts. Like, how can another human being say that to somebody else? You know, he's like,
Right.
well, you don't even know them. And I'm like, but that hurts. Like, that hurts.
Oh yeah.
And I mean, he's like 140, you know, he has no, like, he actually has the opposite issues. Like, you can't gain, you know, and stuff. So I'm like, what? But that's the plus side as well, is that he has been so supportive. He's been there every step of the way. He has been just like, oh my gosh, like, you want to go for a walk? Let's go for a walk, you know?
Right.
And stuff. And even on my bad times, when it's like, so I use food. I'm a food addict. I use food to cope. And so a little bit, let me go back. So 2013, I ended up having weight loss surgery. I had the gastric bypass because I didn't know what else to do, you know. And at that time, you have people like over here like, oh, I'm absolutely not gonna do, you know, weight loss surgery. Other people are like, you know, that's like, you need to. And so I was like, what do I need to do for me, you know? And so I did have weight loss surgery 2013. It was the hardest thing I did in my life. Hardest thing I've ever done. And it has been the hardest thing, because, you know, all of a sudden you're cut open. Like, and I didn't have a laparoscopic procedure. I had an open procedure, and that was the hardest thing. And I was like, I had buyer's remorse. I had buyer's remorse for like a month.
Now, let me ask you a question. A lot of times with the weight loss surgery, one of the selling points for us is that, you know, you'll see such a drastic change. You'll have such a huge improvement of your quality of life, from just the ease of being able to do things and gaining your mobility to having a reversal of some of those pains, right? So what kind of obstacles did you face after having your surgery, with not seeing that reversal? Did you not see it? Because I mean, I've followed you for a while, so I kind of know, but like, you know, what happened with that? Did you see those when you're talking about buyer's remorse?
Right. Well, because the pain was so hard after, but then I was like, what did I do? And then I actually, things were great to the point where, like, my first month, I lost 50 pounds. I was able to move more. I was like walking and doing all these things. But, and my diabetes was basically like in remission. Like, it literally went away. Like, within the day I got out of the hospital, I was no longer diabetic. So for me, that was totally worth it. Like, just that alone was worth it. But as I lost weight, I found that all this weight that I had on my body, as it started going away, the pain issues started coming. Like, I got diagnosed with fibromyalgia. I have chronic, like, pain 24/7. Like, I would wake up and it was a different kind of pain. So it was like, like, finally, you know, some of this weight and fat and stuff are off your joints and your bones. But then it's like years of having that, you're like, oh my gosh, now I have,
it's a totally different type of pain that people don't talk about. I experienced the same thing after losing a certain amount of weight. Where I never had hip problems, I started to have pain in my hips because of the change of the distribution of my weight and how I was walking and how I was sitting, and all of those things like start to change as your body changes. And so even that, people expect for you to, you know, have, again, like, have a reversal of all these things and to be able to move more and do more and to be okay. And it's like, but there's a whole other level to that, a layer there. You have that people don't necessarily realize, you know, happens. And I think that it does impact our relationships. Like, you made the comment about, you know, not wanting to go out, not wanting to be around friends. And I'm sure, you know, for me, when I was at my smallest, I was very, very social, and I love to be around people. As you guys can see, like, I have a problem talking and being around people. But the more weight I put on, the more difficult it was to be around people, to go out into social settings. And it wasn't even from embarrassment. It was from
Right.
knowing I wasn't going to be comfortable.
Yeah.
And I was going to be in pain and having to explain that to people
Right.
and them not quite understand, you know?
Yeah. Well, it's hard. It's hard when people expect, okay, well, you've lost some weight, so you should be good now. And some people are. Like, we're
Yeah.
all different. We all have different, but now I have arthritis. Like, I have arthritis. And for me, having gastric bypass, I can't take any NSAIDs. So no ibuprofen, no, like that kind of stuff. I can't take that. And when you go and to the doctor, like, that's one thing you always have to say, because I could get an ulcer from taking something like that, even one time. So it's a constant thing. It's like, okay, arthritis, how do they treat that? With NSAIDs. And I can't do that.
So you're saying that, and I'm thinking like another possible side effect, I want to say, to having gastric bypass is most people, after they have the bypass, they end up having gallbladder issues and having their gallbladder removed, right?
Yeah.
So then if that happens, some of the other maybe more homeopathic things, like a higher fat diet and fish oil, you also can't really take, because you don't have the gallbladder to process that fat, right? So that causes a whole other issue. Yeah.
Right. Yeah. And I still have my gallbladder, but high fat still affects it. It bothers me. Like, I can't do, people have jumped on like the keto train and all that, all this stuff, which I think is amazing. And some people can do it, but me having gastric bypass, I can't. Like, I can't. And just recently, because I've had to actually have a revision. Last year I had a revision of my original gastric bypass. And so it's even harder. Like, it's harder. And stuff. And so, like, over the years, it just seems like the pain has gotten worse, but it's not the pain what I had before, like, where, oh my gosh, I can't stand up. I would literally, it would take me 10 minutes to get out of bed, because I couldn't, like, literally stand on my feet for 10 minutes because it would hurt so bad. Now it's a different kind. It's like the joints hurt so bad. And like, I can sit on the floor and I can get up, but it takes a while, not because of my weight anymore, but because everything hurts,
Right.
And it's still mentally, so mentally it's harder for me than physically, because mentally I'm still 600 pounds. Like, I'm still, there, because I'm like, oh my gosh, if I go somewhere, are they going to have somewhere I can sit? Do I have to stand long enough? Is, just like everything. And that affects, like, emotionally, that affects me, which contributes to my pain, because it's like, not only am I physically in pain, but I'm emotionally, like, mentally in pain, and stuff. And I know that a lot of people who don't have, like, especially people who don't know what it's like, and they think, okay, well, I just gonna have surgery, or I'll just start working out, because they tell you, if you're this big, then you should be able to lose weight really, really fast. But there's other things that come in, are a factor. Like, I have PCOS, I have like tons of medical conditions, and like, just I'm like, there's always something, there's always something.
There's layers to it all the time.
And it's like, people are like, oh, you should be good now, you should be good. And I even had skin removal, which my very first one was a paniculectomy. So they removed the pannus, and that was 30 pounds.
Which is your stomach, right?
Yeah, like the bottom part that hangs, because it would hang down to my knees pretty much. And so they removed that. That was 30 pounds that they removed. And I remember the first time I got up to go walk, and I literally almost fell over, because you know, when you're big, you have to like account for all of your, like, your whole, all your weight, you know?
Body,
and then all
right.
of a sudden 30 pounds is gone from in front of me, and I'm like, I almost fell over. Like,
It's a
you
totally
know,
different life. It's a totally
oh
different
my
life.
gosh. But at the same time, and people are like, oh, you're good now. But then you got this, like, it's so hard. Like, I still have huge, like, my thighs are big, you know, I have a, like, I'm just big everywhere. Like, you know, some people have like the smaller legs. I'm just big everywhere, you know?
Right.
So when removing that has made even clothes harder, because I have big thighs but smaller waist. And I'm like, ugh, you know?
So let me
So
ask you, with the
yeah,
pain and everything else, and then having the surgery, you said you had some buyer's remorse. Would
yeah.
you do it again?
I would
Knowing
do it
what you
all
know?
over again.
Yeah.
I would do it all over again. Like, and I say that all the time. You know, this isn't for everyone. This
Right.
isn't for everyone. And even, you know, even someone that may be 500-600 pounds, it's not for everyone. Like,
Right.
but one thing I do wish, I wish I knew more about what I was going to go through than
Yeah.
I did then. You know, I wish I would have known more, you know, but I don't regret it, because I feel like it has made me stronger. It has helped me with, so I've had diabetes for quite a few years. I've been on insulin. I've been like, and actually I've had many family members um, who have passed away from
Mm-hmm.
complications, or have had, you know, toes amputated, you know, just, it's scary. It's scary.
Right.
So I didn't want to have a heart attack. I didn't want to die. Like, I didn't want to. Even though I like prayed I wouldn't wake up, I really didn't want to. I just didn't know what else to do, you
Yeah.
know, and stuff. So even though my life is so much better now, it's like a different kind of worse, you know? It's a different,
Yeah.
because I do live in pain every single day. And that's one thing I have to deal with. Like,
Yeah.
okay, yes, I'm much smaller. I never thought I would be. Currently I'm at 385 pounds. And
Congratulations.
that's crazy to me, you
Yeah.
know? That is just crazy. Thank you. That's just crazy to me. But it's like, I didn't think that I would be dealing with this pain that is like, it's such a bad pain. Like, I try everything. And I'm getting a little emotional, because it's like, when you try to explain to the doctors that you're in so much pain that you
Yeah.
can't stand it, they don't really believe you. They don't
Yeah.
believe you, you
And
know?
that's why I wanted to bring you guys on, because I think this is a struggle that a lot of us deal with.
Yeah.
And it crosses all weight sizes. You know, there are people that are in smaller bodies that have the same issue.
Yeah.
And you know, people tend to think that if you're in a larger body, that the quick answer is to lose weight and you'll feel better.
Yeah.
And I think your story is definitely one of those that shows that that's not always the case. I want to thank you so much for sharing and being so open and vulnerable
Yeah.
about your story and what you've gone through and your experiences. I have a lot of comments asking like what we can do. What are some of the
Yeah.
treatments we can do? I
Yeah.
want to go ahead and bring on Melissa, because I think that this is a great time to kind of get some of those answers.
Yeah,
And being a
absolutely.
physician, I
And I
think
just
that,
want to, before I go, I just want to say that, you know, there's a lot of us who have had weight loss surgery, and then there's people who haven't. And I have nothing but love for people who have it. And I think, like, me and you have been friends for a while, and you've always been there for
yes,
me, and I appreciate it so much. And the thing that I love about this community is that you're never like, oh, well, you had surgery, so it must be easier for you, you know, and stuff, because we all work hard. And I appreciate you so much. I still, like, you know, am a total fan. Like, even though we're such good friends, I'm just like
right.
total fan, you know, and so I appreciate you bringing these kind of topics to all of us. And Thank you for having me on. And, if anyone else has any more questions, don't hesitate to message me. I am always here, always willing to, well, you know how I am. I'm a talker. So if you have any questions, as far as me, what I've been through or anything, I'm more than willing to answer them for people. So
Yeah,
thank you for
I have
having
her
me
tag.
on.
No, thank you. I really appreciate you coming. I have Alicia tagged in the last post that I made today, announcing that we were going to come live tonight. So if you guys have any questions for her, definitely pop over, send her a DM, at her. She's amazing. And thank you so much. I
Thank
really
you. Have a good night.
You too.
Bye.
Okay. So that is, a huge, I think probably surprise for some people, as to what it's like to live in a larger body with pain and to have gone through some of the medical interventions that we're told will be helpful, and what it looks like when they're not necessarily. So now I'm going to go ahead and bring on Melissa, the challenge doctor, and I'm so excited. I'm so grateful that she was able to take some time. Let's see. Hi, beautiful. How are you?
Good to see
Good.
you again. It's
You
been a
too.
while.
I know. It's been about a year.
Yeah.
Can you, before we get into the good stuff, can you see the comments? Does it say
I
that you're connecting?
I see that I see my face on there. Do you see me?
I see you. I want to make sure everybody else can see
Oh,
you.
okay.
Can you guys just drop a number 1 in the comments and let me know if you can see and hear Melissa just fine before we get started? I just want to make sure that we don't lose you. Oh, perfect. Okay, so we can hear you, we can see you.
Good.
So, Melissa, we met a year ago, exactly a year ago, right?
Is it?
I think it was, yeah. At
Shalene? Was it Shalene
yes,
Johnson?
It was.
Yeah.
It was at Marketing Impact Academy Live. And you came up to me and we spoke and exchanged information, and I think we've been following each other since. And
Yeah.
I knew one day it was going to make sense to collaborate and do something together, and this just seemed like the perfect thing. So I am going to let you introduce yourself and tell everybody what you do, and then I think we had a couple of questions for you too. So, and I'll let you kind of put your input on what you've heard so far.
Sure. Well, again, I'm Melissa Katie, and I should give you a little background on my training. What I'm doing now is diverges a little bit from what I initially was trained in, but I went to medical school, and I went to an osteopathic medical school. I was accepted to an MD school as well. We could talk about the difference, but that's not the topic of interest today. But medical school, and then 1 year of general surgery. I did a year of internal medicine, 3 years of anesthesiology, and then I did a year of a pain medicine fellowship, and then I became board certified in anesthesiology and in pain medicine. And from the get-go, I was noticing towards the end of my pain fellowship that I was doing a lot of things a little differently than a lot of my fellows, and I was spending twice as much time with my patients. I was not encouraging them to do as many interventions as I'd been taught to do, which a lot of pain medicine fellowships traditionally have been where they train you to do injections and like epidural steroid injections, or putting in pain pumps to deliver medication into the spinal fluid, or doing spinal cord stimulators to confuse the spinal cord area, so that you don't notice the pain as much, but those can change as well. So I noticed that there was, I wasn't doing as many interventions, even though I was doing them and learning them, but I was also finding that I was helping people in ways that other people weren't. And that was kind of the beginning of my journey of questioning kind of some of the things that we were doing, because people in the private world, as I was exploring before getting out of my training, that, the patients kept coming back, and you were just treating symptoms, and these are typically diagnostic tests or some steroid to decrease inflammation that may or may not be there. And so there's always consequences to any intervention, and that is just a reality. And so you can't always predict when people have a bad outcome. You do the best you can, but I think I had the biggest problem with, I felt like people weren't educated well enough on these, why we're doing what we're doing, and understanding their pain better. And instead of just numbing the nerve, why is the nerve all fired up? And
Yes.
so, but the problem is that through this journey of 9 years, I have been working 3 to 4 days a week as an anesthesiologist and doing general anesthesia and regional anesthesia work. And this whole journey of the last 9 years, I've been traveling to extensive conferences that are not necessarily physician conferences. I find that I kept going to the same physician conferences, and they just rehash different ways of, giving a drug, taking away a drug, doing, and it made no logical sense to me. And you have to understand the background of what I've dealt with is a lot of intermittent, persistent back pain that I've self-managed myself. And I'm just that kind of person where I'm always trying to figure out ways to make it better without, doing all the stuff I learned to do. So,
Right.
yeah. So the reality is most time pain is not life-threatening. You rule out the red flags, you make sure, and just for the audience, I'm obviously not going to try to be your physician today. I'm trying to give you a little education background, and obviously you need to be examined to rule out red flags, which just mean really life-threatening things like cancer or infection and stuff. But what I found along this journey, and I'll be happy to give you some names or references, but there's a lot of research and pain science that's been going on that I want to tie this into a comment made earlier. And congratulations, by the way, Alicia, and to you, Jai, for all the excellent work you've done with yourselves in helping others. But yeah. So there's this sense that I know Alicia got sentimental when she talked about not feeling like physicians really believe her. And I will give you a little clue onto really what I think is going on. And so when physicians, of course, they can be busy and they can be overwhelmed and almost like a burned out situation. But really a lot of times what happens is most physicians are not trained on the most recent pain science. So, and there's a lot of other reasons too. People want things to go away really fast, and there's not a lot of time to educate patients on the pain science, and physicians aren't trained in the pain science to deliver it to patients. So the entire country is kind of pain education deficient, and it makes it really hard for have effective, sustainable pain care and empowering patients to really take hold of their life and look at all the different things and guide them and facilitate change in their pain. Right. Unfortunately, there's just a lot of things thrown at you, and passive interventions are not empowering you or giving you any skills. And so a lot of times physicians are very frustrated. They're very frustrated because they don't have an answer and they don't know how to help you. And I think, unfortunately, it comes across like they don't care or they're not listening. Now, I know physicians that some of them just don't care because they've had enough of whatever they're dealing with. But right. I would say most people go into this profession with the hopes of helping people. But persistent pain, which is what in the pain science world we call it instead of chronic pain, because chronic makes it seem like it's forever. But pain is actually always changeable. It may not be full pain-free, but there are many ways that you can actually change pain. And I'll be happy to go into that in a little detail if you want me to.
Yeah.
But that's my background. So I do a lot of education online. I've done tons of interviews, like you're doing interviews. I've created an online community, which as of yesterday, I've made it free access to all the professional interviews too. So these last 2 or 3 years, I have over 50 professionals I've interviewed that are a little bit more, I would say, patient-centric and very compassionate and really always trying to learn versus just stick with what they learned at the beginning. Mm-hmm. And we're all on a different journey, whether you're a patient or you're a clinician. News flash, none of us know everything. And we have to admit that this is always going to be a journey of the patient the patient is in control of their life, and you have to understand their story. If you don't understand their story, it's really hard for you to help them figure out what are those things that are more relevant to that patient that's going to help them the most with their pain.
And
So
thank you so much for saying that, because I think as patients, we're taught that physicians are kind of the know-all be-all. And I think sometimes we take a back seat to advocating for ourselves, you know, versus what you said, which is that we are in control of our bodies, right? And so when you go in already feeling kind of like you don't have a say-so, that what this physician says is just going to be rule or law, you know, it makes that dynamic really complex, and it makes it really difficult to get the care that you actually need. To no fault of either or, right? It's just kind of the way we've, as a society, the way we've been raised, right? So thank you for saying that, because I think more people need to hear that you have control of your body and you have control of your healthcare, you know, and it's okay to step up and say, hey, you know, this is not working. I need to get to the root of this, and to kind of demand that workflow with your physician, right? So that you guys can come to some type of an understanding and education plan together.
Right. Well, don't get me wrong. If there's an acute situation that's an emergency and you're bleeding out from your aorta, I'd say just shut up and let them take care of it. But
that's a little different.
Yeah. Well, I'm talking about chronic illness, persistent pain. These are things that no one in the few hours in 1 year that you see a professional, there's very few, in those few hours, they can't control and dictate your life. We know that there's 24/7 when it comes to how we're living our lives. If we are not empowered and don't do those things away from professionals, you're not going to make a bigger impact on your chronic illness in most cases. So especially when it comes to persistent pain, and I can give you some references on learning more about pain, but when it comes to the experience of pain, it's not just a linear process. You don't just, it's not about just putting your finger on the stove and you pull it away. That's, you know, that's an acute thing. Pain is an alarm. It's trying to tell you something's not right. And there are times when things are not right for a while, and actually the persistent pain, the pain becomes an illness in and of itself, and you get this wind-up phenomenon that happens in your nervous system, which makes you even more sensitive to painful type stimulus. Okay. So like fibromyalgia is just an example. The way I describe it, it's a sensitive nervous system.
Okay.
So when you think of pain, whether it's fibromyalgia or other pains, pain is composed, I'm going to use an example of a pain physician who actually quit doing injections as well. In fact, if you go to thepainclass.com, there's a free 1.5 hour course that he put together. It's free to learn and understand. So there's emotions, there's your thought, or what they call cognition. So you're thinking, like if you have fear, you're perceiving this is all a bad thing. That actually makes your pain worse. If you have anxiety or depression, talking about the emotion part, anxiety and depression magnify your pain. My example I give people is if I just told you won $1 million, Jai, and you stubbed your toe or you had some pain, you probably would not care about the pain as much, or this where you're feeling this pain as much as if you'd just broken up with a boyfriend or something like that. So
there's actually something to, there was a day that I went to the gym and I had had a really hard night the night before, like really difficult evening, and woke up and I wasn't in the best headspace, like emotionally I was having just a bad time of it all. And when I went into the gym, my back seemed like it was even more aggravated than normal. Like it was just almost torture being there and working out. So I kind of thought that maybe it was because, you know, so much was going on emotionally. But I'd never heard that there was like a true connection. You know, like nobody has ever said, yes, that is a real thing. So that's a real thing.
Yeah. So if you've ever heard a kid say they don't want to go to school and all of a sudden, you know, they've been bullied or something and they suddenly get abdominal pain, they're not making it up. I mean, if they feel abdominal pain, I mean, your gut and your brain, everything is interconnected, and people have to always remember we're amazing, brilliant, intelligent, incredible bodies that function together. They're never separate. Your brain, I call it the brody, brain plus body. It's all one. And you can't separate them as much as you try. So your emotions, and there's plenty of studies out there, the emotions and your thinking, those are the biggest contributors aside from information from the tissues. So where we go wrong in our profession is we focus on the tissues. So the issues are not always in the tissues. All of them are always important, but for each individual, different things can be more important than others. So there's a triangle in that pain class. They show your thoughts, your emotions, and the input from your body. They call it nociception. It's a fancy word. It just means receptors that gather information. So if I do this to my finger and I hold it there for a while, you know, it'll start hurting a little bit. But am I damaging it? Just because you have pain doesn't mean, it doesn't mean you're harming yourself. It's just your body trying to tell you, hey, I don't like that. Quit doing that. That's just too much.
Right.
And it's too much. So, you know, it's a very complex, it takes a while, and be patient with yourself. It takes a while to kind of understand pain and this experience, but it is basically your body trying to warn you as an alarm, whether it doesn't mean you're going to be harmed, but it's just trying to get your attention. So if you've been ignoring this, you know, anxiety or you're perseverating, meaning you're just constantly worrying about something, especially if you think this is a bad thing and I've got cancer, and it can make it worse. So here's a great example of how your mind can play tricks on you. There was a gentleman that went to the ER because he'd stepped on a nail and it was going through his shoe from the bottom through the top. And this person was screaming. It took medication to sedate him, and they had to, you know, in order for them to, you know, they had to take the shoe off to, you know, make sure they didn't move the nail and all that. And this guy was in extraordinary pain, and they took the shoe off. The nail never went through his foot. It was between his toes.
Oh, wow.
So you have to think about the context of how your experience is. And so, you know, anxiety, depression, your state of mind with sleep. Sleep is a huge, if you don't get enough sleep, that's a huge connection with increased pain. One night of no sleep, even in residents that are in training, they start getting aches and pains and stuff, and they've never had aches and pains in those areas. Just a piece of multiple things. There is a huge page of all these things in your life that can contribute and magnify pain. But this is what's unique. It's not, like I said, a linear process. It's more like, how does traffic happen? It's not one car. It's probably multiple things that come together that create this craziness. Or weather. Is it really one thing that led to this huge, massive thunderstorm? So you have to we have to step back and look at our lives and our bodies and our experiences as way more complex. And that's why it's hard to always give someone an answer right away. And we have to be real careful, even for myself, when I deal with, I just try to have positive talk when it comes to if my back starts, I call it just a little angry, you know, I've not been taking care of myself, but I know how to get myself out of it, because I talk to myself in a way that's, okay, breathe. Breathing's huge. Tons of studies with that as well. If we're running our lives day to day like this and intense all the time, and we never give it breaks and give it time to just slow down, that whole system is revved up, and that doesn't help pain either. These are all examples of how it's really self-care, you know, when you think about all of these things. And some people will say, well, wasn't that person have pain? Well, we all manifest different symptoms for different problems. And it's not always needs to be a medical diagnosis. And even if you get a medical diagnosis, in fact, in my, I was going to pull a table from my book, because I think if you're going to take away anything, because sometimes the dangers of the medical system, I mean, there's a place for it. There's a time and a place. But usually it's a bridge. you still have to walk your life and journey of life.
Right.
We're just there to help you from time to time, and there's no shame or anything. Even if people made a decision to do intervention, you can't live in the past. You got to go from here and move forward. But one of the charts, I don't know if you can see that, but so for example, I hear all the time that people have to have surgery because of disc degeneration. I got tons of disc degeneration. I don't care. It doesn't matter. It's like my gray hairs, you can see right there. You know, it doesn't mean I have to fix it. It's not causing me a problem. So just generalized low back pain and someone says degenerative disc disease, there's no real surgical indication for that unless you're having leg symptoms or some, you know, if it's cancer or infection or something else. But in this particular chart I put in here, these are people that have no symptoms. So you got to remember what I'm going to tell you here. If anyone's 40-year-old in your 40s and out there listening, 68% of you with no pain will have degenerated discs.
Wow.
If you're in your 50s, 80% of you will have degenerated discs. But who cares? You know, all it's showing you is that you're alive on Earth in a world of gravity, and things change and adapt. And so it's not going to be pristine and smooth like you were like 10 years old. So there's a lot of, and I say this, and I really wanted to share that part because I have other charts about these kind of things, but there's so much fear that people have with diagnoses that it makes them make decisions that may not be good for them. And this is what led me to writing my book. It led me to creating Pain Out Loud, makes me go on social media and make myself vulnerable and have, you know, other physicians that have been trained to do what I do that don't understand the newer pain science. It kills me to see people misguided and not well educated about these things. So that's why I'm on here.
And I appreciate it. So you mentioned that breathing was definitely one thing. And I think maybe, you know, tying in with that self-care is like the whole meditation aspect, right? And taking the time to get proper sleep and slowing down. One thing that I've used a lot in my life, and I think I learned it from birthing my children, but it's, you know, breathing techniques and breathing through the pain and being able to kind of breathe it away, so to speak, right? But one question that's been asked a couple of times tonight and was also in the post was, is there a specific diet that can help relieve pain and or like everyday pain? And if so, what is that? And I think we spoke a little bit about that with Alicia too, because a lot of times we hear like increase the healthy fats, especially when it's like joint pain and nerve pain. And, you know, some people can't eat a high fat diet because of, you know, their digestion and processing of those fats. So is there something that can be done, you know, diet wise as well?
Sure. Well, first of all, I'll say I'm not a dietitian or a nutritionist, but I will tell you, I think it's best to, you know, each individual's different. There are some people that have sensitivities and have a response to food items more so than others. So your vulnerability is an important issue, and only you know what you feel based on it. But there's ways that people can do elimination diets where they start adding in one thing at a time and paying attention to the things that start bothering them. So some people, it's dairy that bothers them. Sometimes it's tomatoes. They can have an inflammatory response. But I think the best quick approach is to avoid processed foods and straight up sugar. Sugar creates a situation in whether you have diabetes or not, there's advanced, what they call AGEs or advanced glycation end products. And these proteins attach to the glucose molecule, and they basically, the body responds to it and kind of attacks it in an inflammatory type of process. So, you know, I can't go into extensive detail on that. I just know that this is not a good thing. And so even for friends of mine or even my husband, when they knock out sugar, some people will do it, they'll just do it maybe, you know, for a month or 2 months, and they will notice significant changes in their joint pain that they had. And a note about arthritis, there's a lot of arthritic changes you can have, but it doesn't mean you have pain. So there's a ton of studies on not just like this thing I talked about, the MRIs of backs and stuff, but people that have knee abnormalities, shoulder abnormalities, And if you look at people that have no pain, you'll see the same abnormalities. So what you see on an image doesn't tell you about pain. That's like me looking at an MRI of your brain and being able to figure out what you're thinking. Like, it doesn't tell you how you're functioning or what you're feeling. These are just structures. And again, we keep focusing on tissues, but we know that pain is not just about tissues.
Right.
That is probably the biggest, I mean, it's not irrelevant. It's just we have to always consider the big picture.
Yeah.
So you start poking at stuff in the tissues, you have risk of creating more pain. But if you don't evaluate, and physical therapists are, I think, better adept at musculoskeletal. If you have someone that's pain science trained, now this is the trick, is finding the right person. I'd probably go to McKinsey. I'd probably go to a McKinsey trained physical therapist. They tend to stay up with the pain science too, but there's some non-McKinsey trained physical therapists that are great too. But so as far as nutrition, hydration, avoiding sugar, going for, real foods. Sometimes, when it comes to toxins that are lacing all of our foods nowadays, it's really hard to know what to get. Organic doesn't always mean organic. The EWG.org, the Environmental Working Group, you can find the, the Dirty Dozen, Clean 15, figure out like avocados, like I guess the number one cleanest one or whatever. But, where you have the risk for other, things, toxins can create a problem too. There's people that have deficiencies. Vitamin D is not really a vitamin, but it's an important hormone that's part of, it can be a process involved that can increase other problems, whether it's chronic pain or other things. It's not definitive. It doesn't mean it's definitely going to cause a problem in you, but most of us are deficient in vitamin D. Many of us are deficient in magnesium, especially if we're not eating like whole foods diet. And Michael Greger, Greger, he's with nutritionfacts.org, has great free resources, quick little videos to help you learn. It's basically science-based. He is vegan, but regardless, if we need to kind of lean towards getting some real foods in us, because we tend to go processed. So, I think there's a definite impact, but whether or not the nutrition is impactful on you as others, you don't know till you try.
You do it. Yeah, no, definitely. Definitely. I want to thank you. Can you tell us where we can find more of you, your website and your book? I think this has been extremely beneficial. I've been following you and I learned some new things. So thank you. So where can we find you and where can we get more of your goodness?
Oh, well, you're sweet. Well, challengedoctor.com is where my main site, where it shows everything I'm doing. In fact, there's even a video even has me receiving anesthesia a couple years ago. But it teaches you what you should know about elective anesthesia. So it's like a 19-minute video. So feel free, it's free. But it also links to all the things I'm doing, including Pain Out Loud and the book and everything that I'm doing. I'm on YouTube and trying to get into this Instagram thing. And Facebook and Twitter, but Challenge Doctor is kind of my label because everyone seems to misspell my last name. But if you put melissakatie.com, it'll go to challengedoctor.com. It's just easier to say Challenge Doctor. Yeah.
Right. Well, thank you so much for taking some time out of your evening to talk with us.
Sure.
To share some of those. I don't know if you can see the comments, but some of the comments are coming through that I appreciate this so much. I really needed this. This was amazing. So if somebody asked how much water do we need, I think, the general rule of thumb is like eight cups of water, 8 glasses of water, or half of your weight in ounces typically. But I think that all is kind of relative.
It's very dependent.
Yeah. I mean,
it varies. There actually is no perfect answer to that. I've looked this up on multiple occasions and there's no perfect resource for that. And if you're on diuretics and they don't want you to have too much fluids, you got congestive heart failure, or you have some renal kidney problems, like you got to base it on your circumstance. But if your thirst mechanism is working and you feel thirsty or you got chapped lip, like look at the common sense stuff. Yeah, I mean, we need to flush our kidneys.
Pee clear and you should be thirsty.
Yeah, clear, very light yellow,
right.
Not that medium to dark amber.
So shoot for not actually being thirsty, like not having dry mouth, dry lips,
Yeah, I
feeling
mean,
like you need to drink, and to have like clearish pee, like not yellow.
yeah. I mean, we
Then
just need to.
you should be good.
Yeah, we should be listening to our bodies more. We're so distracted that we don't really we're not listening to the signals and information. And sometimes pain is a manifestation of your body trying to get your attention. I
Right.
mean, look at cats. No one taught them how to do a downward kitty. Like, I mean, they just know that I need to stretch, and no one trained them to do that. Like they just are in tune because it's their basic instinct. But we're kind of losing touch with ourselves, and we need to get back to paying attention.
I agree. I definitely agree. Well, thank you for telling us and showing us a little bit more about how we can do that. And
Yeah.
I appreciate you so much. So you guys, I will pin Challenge Dr. Melissa's information so that you can easily find her. I'll put it in the comments. So I'm just, again, thank you guys so much. Thank you everybody for staying on with me through the little tech difficulties and everything that we had. I hope that you guys found this, helpful. If you have any other questions, go ahead and post them in the last post that I made for today's topic, and we'll be checking back in and responding and getting back to you guys. So all right, well, I'm going to let you go. I'm going to go ahead and end, and we will be back again next week. So be looking for updates about our next topic. And if you want to have a chance to come on live with me during our Dear Skinny Friends, don't forget to go and fill out an application, because it is open, and I want to see all of your beautiful faces here with me. So, all right, guys, we'll have a good evening, and we will chat soon.